All right, good morning or afternoon, depending upon where you are, and welcome to the Spring Online Clinical Educators Forum. I'm Dr. Greg Waldorf of the MCPHS School of Optometry, and I'm filling in for Dr. Alicia Feis of ASCO, who unfortunately has lost her voice. She serves as chair of the ASCO Clinical Affairs Committee, which is bringing you this forum through the support of the Clinical Directors Administrators SIG. Next slide, please. If you were able to join us for our fall OSEF, the theme then was engaging today's students in the classroom. Today's topic is engaging today's students in the clinic. We have a great lineup today, and I'm looking forward to hearing from our speakers. Next slide. I'd like to acknowledge the Clinical Affairs Committee members, Dr. Don Godey, Dr. David Hall, Dr. Bazant Labib, Dr. Michael McGovern, and Dr. Amy Moy, as well as the SIG liaisons who serve on our committee. Next slide. Thank you to this year's OSEF co-chairs, Dr. Valerie Kattouf of ICO and Dr. Amy Moy of NECO, who both volunteered to steer this program and effort. Also, thank you to each of our presenters who have taken time from their busy schedules to be with us today. Thanks also to Ms. Jennifer Rubin, our Clinical Affairs Committee staff liaison at ASCO, and additional thanks to Sarah Lau at ASCO for helping us out behind the scenes today. They have all been instrumental in bringing you this forum. Lastly, we want to thank our on-site OSEF liaisons for helping us spread the word at your campuses about this important program we have for you today. Go ahead and change the slide, and here is today's agenda. Just a few requests before we start. If you're watching as a part of a group, please make sure that you have each attendee sign an attendance sheet and send the final sheet to Jennifer Rubin at ASCO. Please take a moment to double check that you are on mute, and please remain on mute throughout the duration of the event. We will be accepting questions in the chat during our Q&A portion of the program. Please keep your camera on if you are a presenter or moderator. This meeting will be recorded today for posting on ASCO's YouTube channel, which is accessible through the ASCO website. And Ms. Rubin will send a SurveyMonkey link to each registrant shortly after the conclusion of the program. Please complete the survey so that we can utilize the information to better meet your needs and for future planning. We have 3 excellent sessions prepared for you today and 2 moderators who will do our hosting. So without further ado, let me hand over things over to our first moderator, Dr. Amy Moy.
Thank you so much, Dr. Waldorf, and for the housekeeping notes. I would just add that you can put your questions in the chat at any time, and we will do our best to answer them by the end of the presentation or later in a summary. And now on to our forum. We have wonderful speakers today from several of the ASCO schools and colleges. These speakers were invited to this panel because of their expertise in engaging with students in the clinical setting. Next slide, please. Next one, too. Our first speaker is Dr. Julie Lee. Dr. Lee will speak about strategies for engaging Gen Z in the workplace with clinical applications to precepting optometry students. Dr. Julie Lee is a clinical psychologist, faculty, digital mental health strategist, and Gen Z advocate. She is Director of Technology and Mental Health of Harvard Alumni for Mental Health and provides strategic advisory service to tech-driven mental health ventures. Her approaches to people, culture, and the workplace have been implemented by Fortune 500 companies, including EMC, Boston Scientific, Deutsche Bank, and Verizon. And she teaches a leadership course at NYU. She is a former Associate Dean of College of Brown University and researches, writes about, and advocates for Gen Z and young professionals. She provides training and consultation to companies and educational institutions about creating a climate and culture that promotes engagement and wellness for young professionals and students. She has published in Harvard Business Review and Fast Company. So now I will turn it over to you, Dr. Lee.
Thank you, Dr. Moy and members of the planning committee. Thank you for inviting me to this engaging session, and I'm delighted to have this opportunity to talk about something that's close to all of our hearts. Those of us who are educators and clinicians care deeply about our students and trainees. So I look forward to having a conversation with all of you and to also learn from you through this session. Next slide, please. So objective of my talk would include really understanding who Gen Z are and their demographics, and some of the events that have shaped their perspective and outlook. We'll also talk about how Gen Zs bring a unique set of workplace values that are distinctive from the values of older generations. And we'll talk about some strategies that are likely to be effective in engaging and empowering our Gen Z students and trainees. And lastly, it is my hope that by the end of this session, that all of you will have opportunity to really think about at least one strategy that you would immediately put to use to engage your Gen Z interns. Next slide, please. So this was already mentioned by Dr. Moy, so I will just add the fact that the reason I consider myself a Gen Z advocate is because I care deeply about this generation. They have gone through and experienced a range of significant societal and global shift in the last several years, obviously including COVID-19. They are our future, both in school and in our workplace. And I believe it's critical and important that we understand and support and empower them so that they can reach their full potential. Next slide, please. So I like to start this conversation by really pointing out the fact that we have a very interesting and engaged generations at work. We have 4 at the minimum, or 5, depending on how you, whether you separate the boomers into 2 cohorts or not. We currently have at least 4 generations working together across teams. And this is a very unique context to understand some of the challenges as well as opportunities that we are experiencing in our clinical settings. And the multi-generational workforce is likely to continue as workers will live longer and is likely to work longer. Partly due to economic needs, and partly because we know that longevity is actually increasing in our society. With that in mind, it's important for all of us to recognize that each of us are a part of a generation that has a distinctive set of values and outlook that's been shaped by social, political, economic, and technological advances. And each generation may bring a different view about what is important when it comes to work-life balance, what we value in our workplace, and what we expect from one another in workplace. While some of those differences can create misunderstanding and perhaps even conflict, I also believe they create opportunities for us to learn from one another. I, for one, feel like I have learned a tremendous amount from my Gen Z students and trainees and colleagues. Lastly, I would say that it's also important for us to think of these generational differences as a dimension of diversity, inclusion, and equity. As all of us try to promote and create a climate that is inclusive and equitable, I believe one aspect of this effort should include understanding different generational outlook. So next slide has a table. This is probably something that all of you have seen at some point that shows the birth years of each generation, starting from baby boomers, Generation X, millennials, and Gen Z. So if you look at the current age of Gen Zs, they span from 11 to 26. So you're likely either teaching the students who are probably 21 and older, or working with interns in that bracket, 21 to 26. I noted some of the well-known celebrities or the leaders in each generation, because we could see that if you compare it, sort of the role models that baby boomers had, they're quite different from ones that Gen Zs are looking up to. So that, the differences are well noted here. Next, please. So I'd like to actually invite all of you to share with the group. When you think about Gen Z, please take a moment to think about either student or intern you have had who would be considered a Gen Z, or maybe someone in your family or in your relational context, what are 1 or 2 adjectives that come to your mind? And I would invite you to be honest. There's no a judgment here. I think it's important for us to actually be honestly talking about the fact that there are some people have a very strong view and perception about Gen Z. And one could even argue that some of them may actually spend what we might consider to be sort of positive to less positive. So thank you for some of you who have already started to add. I think many of these resonate with what I've been hearing. They are strong advocates for themselves, entitled, fragile, innovative, tech savvy, impulsive. These are a wonderful kind of and accurate, I believe, of a description that I have heard from supervisors and educators. Open but quick to judge. Again, I think that also resonates with me as well. Collaborative. I think what's really interesting about Gen Z, as I speak with them and also read about research, is that people often assume that Gen Zs are less relational because they are the digital natives. They spend a lot of time on social media and technology. And sometimes it's easy to assume that they're less interested. But in fact, it was interesting and important to note that when asked their work preference in terms of working in the office, hybrid, or remote, compared to older generations, Gen Z actually wanted to work in the office because they wanted the experience of working alongside their peers and their colleagues. And a couple more adjectives that came in are accepting. I absolutely agree. I think they're very open-minded and inclusive, and and absolutely they're great at multitasking because that's how they grew up. And sometimes the outcome or a consequence could be that they may actually have a slightly shorter attention span. So thank you for your input, and let's go to the next slide, please. So I wanted to just touch upon some impactful events that have shaped Gen Z's outlook and their values. And the reason I believe it's important for us to talk about these is because we're all product of our life experiences. And sometimes I think we are not fully aware of impact some of the experiences have had on Gen Z interns and students. First and foremost, they went through COVID-19. Through that, they experienced social isolation, remote school, and many of them, sometimes close to 60% of Gen Zs have noted that they struggle with mental health issues during and following COVID. As I mentioned, they're digital native, and their life has been immersed in technology. Of course, they use social media extensively, and they're now really coming to age when ChatGPT and other generative AI is taking a hold in both educational and professional settings. They lived through Black Lives Matter, the Asian hate and gun violence, and have sort of seen firsthand some of the consequences of systemic inequalities that exist in our society. Some of them will say that they've also witnessed the inability for institutions to promote equity across a dimension of society. And some of them will attest to the fact that they have lost trust in government and institutions. And lastly, it is important to note, and you probably noticed from your clinical settings and classrooms, that Gen Z is the most diverse and most educated generation ever in the US. In fact, they're poised to be more than 60% individuals of color. So what are some of the work values that Gen Zs might bring to the work setting, the clinical settings? The word that probably best captures their value is authenticity. The Gen Zs really want to connect with their own voice and want to actually have an opportunity to voice their voice and opinion. They're also very interested in learning and professional growth, actually even more so than older generations. Because of their commitment to equity and inclusivity, they expect employers to really reflect those values and live out those values. In fact, many Gen Zs, when they're looking for a job, they often go to the website of their potential employees and see whether or not there's a diversity reflected in the leadership profile. They absolutely value work and life integration and balance, and I actually really respect them for it. And they're more likely to pursue or be interested in entrepreneurship. Some of them actually may already have a side gig, even as a student. And some of them may even consider, a digital nomad, obviously not when they're in school or clinical settings, but often they take opportunity to travel and experience different cultures and working remotely. And they are likely to embrace opportunity to work remotely and have flexibility. And in terms of their leadership style, as they are integrating into our workforce, they're seekers. And their leadership style is to be determined, because some of them are just starting to move into a managerial roles. So based upon the article that I published in Harvard Business Review, these are 3 strategies that I recommend in how we can engage Gen Z. And they are transparency, how to motivate them, and how to connect with them. Under the transparency, I believe the Gen Z are very interested in knowing information that impacts the work that they do day to day, as well as the clinical setting and the work setting. Part of that is due to the fact that they have experienced a lot of uncertainties, and they may have developed some level of fear or anxiety about not knowing what is to come. So Gen Zs that I have spoken to and consulted said it's really important for them to know what is happening in the clinic settings and why. If there are going to be changes that is going to be made, they like to know in advance. Transparency also include really showing them what is expected from their professional work, as well as what is likely to help them progress in their career when they're done with their training. They appreciate specific, timely, and constructive feedback. I know there's some questions and thoughts about how do we deliver performance evaluation that is likely to be received. And hopefully we'll have some opportunity to talk about that. The second point about motivating Gen Zs. Gen Zs are highly motivated. However, I think there are contextual elements that actually make it even more engaging for them. Gen Zs really want to make a difference. They want to know why their work matters. That's not how I felt when I was in my 20s. I went to a workforce and I did the job that I was given, and I didn't ask questions. But when I speak to Gen Zs, they really want to know how their individual contribution contribute to the collective effort. And I admire for them. They also like autonomy. And this is where I think supervisors and educators really need to balance autonomy and supervision. They also, it's really important for them to continue to connect with a sense of purpose. And lastly, as I already mentioned, Gen Zs are incredibly relational, and they're interested in making a meaningful connection. I would say perhaps because they have so much digital connectivity, I think they value the relational connections even more than we might perceive. So one of my recommendations, and something that I try to do, is to really get to know Gen Z students and colleagues individually. and show that I am interested in understanding and knowing them as a unique individual and what is important for them in their training and pursuit. So I have a simple and quick case study here. James is a third-year intern taking classes and doing 3 days of clinical work. Dr. Smith, James's supervisor, noticed that James has been struggling to complete all his responsibility during the clinic days. At times, James seems distracted and is not engaged with patients. James made some errors in his work. How would you advise Dr. Smith to approach James about their performance? So as we had done a little while ago, I would invite you to either speak if you like, or share your suggestion over chat. So if you have a 1 or 2 phrases or adjective that that comes to your mind in terms of how Dr. Smith should approach James, feel free to share. Yeah, thank you. I think, you know, as simple as it seems, just inviting the student, James in this case, to just check in and asking how they're doing, I think it's really important. And doing it in a way that shows a genuine interest in their well-being. Asking if everything is okay. I appreciate the last comment that says offering your help, to say if you know, if there are issues or struggles that is getting on their performance and ability to complete their task, is to see whether there is something that you can do to support. Right. And I think this is also a opportunity to see whether James has clear understanding of what the expectations are. And sometimes we can't take that for granted. I actually have this conversation very often with professionals, even seasoned professionals. And this says, you know, I thought I understood my expectation, but, you know, when I had a conversation with my supervisor, I realized there were some gaps. So thank you for your feedback. And then that bring us to our last, I believe, last slide. And these are opportunity for review and reflection. Out of those 3 strategies that I share with you, what are which strategies resonated with you the most and why? Transparency, motivating, and connecting with your Gen Z trainees. So I would invite you right now, maybe throughout this session, to think about which one of those 3 resonated with you. It's hard to, I think, for all of us to try to make changes in our supervisory approaches extensively at the same time. So my recommendation is to identify one of those strategy that you would like to implement. I would also, you know, in order to bring this a little bit closer to our heart and our sort of in an individual level, sometimes we see Gen Zs because most of us are not Gen Zs. It's, you know, sometimes, you know, we may be susceptible having some misconceptions or misunderstanding. So many of us probably have a family member or even a friend, someone in community that we know who are between that age bracket. And to sort of think about, oh, you know, the intern that I have in my clinic, it's not all that different from that family member or, you know, someone that I know that I care about. And sometimes I think those perspective shifting could help our relationship. And the last slide, please. You know, feel free to, if you're interested, take a photo. I'm not sure if the deck will be shared, but these are 3 articles that I have published related to Gen Z and their transition to workplace. And I hope you find it helpful. Thank you, Dr. Moy, for sharing.
Thank you so much, Dr. Lee. I think transparency, motivate, and connect are such helpful keywords for us to remember. I'd like to take a couple questions for a few minutes before we move on. if you want to put them in the chat. The first question that has come through is, do you feel that Gen Z's at times excessive focus on work-life balance causes them to miss career opportunities presented to them?
I think that's a great question. And I think it's something that I think about. And what's been really interesting for me is when I speak to both Gen Zs and older generation, is that and I'm a Gen X. Sometimes I, find myself pausing and thinking, boy, they seem to have a very, very high expectation or very different expectation when it comes to work-life balance. And I've heard this from even, some of my colleagues who are part of a boomer generation. And they said, initially, we might feel uneasy, or we might feel you're new to the workforce. How do you think that you could expect to have a work-life balance that's very, very different from the one that we had when we were younger professionals? But I've actually heard people say, the Gen Z's expectation and hope for a more a clear boundary between work and family life and personal life is actually helping even older generations and the supervisor to reflect upon, how is this working for me? How is this working not just for Gen Z, but how is this working for all of us? So what I would actually encourage all of us to do is to kind of come to those conversation and discussion, if there's an opportunity, with a curiosity and open-mindedness, and to really think of it as not something that Gen Z maybe requesting or demanding for themselves, but really think about it as what is healthy and sustainable for all of us.
Yeah. That sounds very wise. I think sometimes the question of work-life balance also brings into play mental health. And how do you see, what kind of red flags could we look for with our Gen Z interns that might signal that something is wrong or going on personally, or they're not able to balance that workload?
Yeah, great question, Dr. Moy. And I think this is an incredibly important one because we know that so many of Gen Z students and interns and trainees and professionals experience a significant disruption in their personal and educational settings. Something that I continue to hear both from K-12 and college faculty member and graduate faculty member is that they're actually observing a gap, both in terms of educational gap as well as professional skill gap, because they've literally lost 2.5 years of being present and engaging with what had been a traditional and typical learning and work experience. Internships were transitioned to remote. We know that working with someone virtually is not same as working along with someone shoulder to shoulder. So I think it's really important to keep that perspective in mind. There are a couple of things that I would say. I think one thing is if you notice something, notice a significant change in your intern's presentation, someone who's been engaged and motivated, and you're seeing a significant decline, I think that's probably an important sign to notice and to approach them to share honestly what you're noticing, and to really ask and invite them to see whether or not they are interested in speaking with you or interested in connecting with some resources that might be helpful for them. So I think, noticeable change, I think, in their ability to complete their work or their presentation in terms of mood and how they engage with one another. I think it's important one to notice. I think second thing that I pay a lot of attention to is how they interact to others in the clinic, in work setting. If someone is really isolated and is not really able to engage or collaborate, there are some people, so I want to be very clear that, there are some of us who are introverted and maybe on the shyer end. So we're not talking about temperamental differences here, but someone who seems to be really removing themselves and to a point that they're not able to engage to complete their task, I think that might be another a reason or sign where you might like to have a conversation privately.
Mhm. Yeah, those are very helpful. Thank you so much for those answers and also for spending time with us, Dr. Lee. It was such valuable information to our audience and as we get deeper into Gen Z. So I appreciate your taking your time, and I'll turn it over now to Dr. Kattouf to introduce the second part of our program.
Thank you.
Thank you, Dr. Moy, and thanks for your helpful presentation, Dr. Lee. We really enjoyed it. Our second speakers are Dr. Mark Wu and Dr. Angel Barajas from Western University, who are speaking on precepting pearls in the clinic among Gen Z interns. Dr. Mark Wu completed his undergraduate studies at UC Berkeley with a major in neurobiology. He graduated from UC Berkeley School of Optometry in 2012 and completed a residency in primary care and ocular disease at the New Jersey VA healthcare system. After residency, Dr. Wu was summoned back to UC Berkeley School of Optometry for a full-time clinical teaching position in the binocular vision clinic and various community health clinics in the Bay Area. During his time at Berkeley, Dr. Wu also discovered a love for pediatric optometry, in addition to binocular vision and ocular disease. Dr. Wu moved to Southern California in 2022 and is currently working at Western University College of Optometry, where he is able to display his clinical versatility by staffing the primary care, pediatrics, neurorehabilitation, and vision therapy clinics. Dr. Wu is currently serving as co-chair of education for the Inland Empire Optometric Society and also has an ACOE consultant. Outside of work, Dr. Wu likes to take day trips to destinations near his house and try all different cuisines Southern California has to offer. And Dr. Angel Barajas was born and raised in the Inland Empire. He graduated from the University of California, Los Angeles, UCLA, in 2013 with a degree in neuroscience and graduated with his optometry doctorate from the University of California, Berkeley in 2018. Dr. Barajas completed his training at the prestigious Baskin-Palmer Eye Institute in Miami, Florida, as well as the community health clinics of Hayward and Oakland. He is certified to treat glaucoma as well as many other eye conditions. Dr. Barajas is also a certified national and California EMT and fluent in English and Spanish. He is excited to return to his hometown of Bloomington, California, and fully committed to the comprehensive eye care of the people of the IE. Dr. Barajas and Dr. Wu, thanks for being here, and I'm going to turn it over to you now.
All right, thank you for having us. I'll begin today's presentation myself. So as usual with any educational thing, we have some objectives for you. And Dr. Lee hit our first one really well, so thank you to her and her presentation. Hoping to sprinkle in a couple more details and hoping that we help you further understand the generational gap. We also are hoping that we can characterize some clinical precepting pearls that we can share with you all. And we want to discuss a couple strategies that you might want to maybe adopt or consider adopting to reach out to the new generations, Millennial and Gen Z. And ultimately, hopefully, you feel more comfortable dealing or handling these students in situations that can come about. So as Dr. Lee did a timeline herself, I'm more of a visual learner myself, so I have this graphic that I borrowed here. And for us specifically in clinic, again, Gen Z and millennials are who we mostly will see, but Generation Alpha is coming on the horizon there, okay? According to ASCO themselves, we don't see them usually until about age 22, so we have some time. 2034 is when they'll start hitting our matriculation time, so we'll talk about them in the future, I'm sure. But for now, we'll focus more on millennials and Gen Z today. So similarly, again, I listed a couple attributes that Dr. Lee hit very well with her presentation. Couple points that I just want to reaffirm is that for the most part, Generation Z is molded by the environment, by the previous generation, millennials, as millennials were by Gen X's. So they kind of get qualities of each other and try to improve upon that, you know. So Gen Z, you might generally say that they're a little bit more competitive. Millennials may be a little bit more team working, but as we learn, you know, doesn't mean they don't collaborate, correct? Gen Z can multitask more because they were inherently more digital based. Millennials doesn't mean they can't multitask. They definitely can. If anything, they're more willing to learn the why of things work, how things work, because they were born in a time without it, and then they move forward to learning into it. So purpose, ideas, and more millennials, generally speaking, security, direction is basically what Gen Z is looking for. So keeping that in mind, that's kind of what we should expect to see in the clinical setting themselves. So a couple ways that Gen Z might throw shade at us, shade being a fancy way of, judging us, the preceptors. They can say things like, oh, maybe my preceptor's a bit intimidating. They don't listen to me. Expectations were not really clear. I'm a bit afraid to ask questions. I don't want to be judged. I don't know why I got yelled at. They can say things like that, or they might even think that we're just using them as free laborers. But, on the other hand, us other generations, we'll teams each other and say similar things about them, right? And this exam is running too long. These students just don't put equipment back. It's frustrating. Generation doesn't really learn for the patient's sake. They learn for the grades, and nobody, of course, wants to participate in case discussions. So we say the darndest things just like they throw shade at us. So we're all guilty of some sense of this, of course. So concepts that overall feel good vibe, as the new kids are starting to say. And again, Dr. Lee hit the big ones for us: transparency, and then everything else she described, we're going to dissect a little bit more, but we consider it more as camaraderie, but with respectful lines. Want to lead by example and overall be fair. Those are the 4 points. So I'm going to dive into transparency, which can take a little bit longer on that end. But again, here's some graphics to show you, because being a millennial, I like the graphics and the animations, I like the technology. So I threw it in myself for my own presentation too. So overall, the goal of transparency is you want to minimize anxiety. You want to address the overall need for security and having their back. So simple things like keeping them informed of changes and kind of making expectations known on day one. So I'll give you a bullet list of what we're going to go through here. So bear with me, because this topic's a little bit longer here. So tell them what to expect, right? So if you're going to go on vacation, you're going to be missing for some reason or be out a little bit, tell them up front. Don't expect admin, or don't wait for admin to tell them, because that might come too late. This develops a connection with a lot of the students that they appreciate. They're like, okay, you entrust us with this information, you care, you think about us. And that's something that the newer generations, they really do appreciate. On top of that, we also have the hard stops. So I went ahead and told you where my personal hard stops, but tell them when you want them to check in. Tell them what clinical findings you expect to double check for them, when you need to complete the charts. So for me, definitely hard stop, no drops until I hear about it. Sometimes it could be after refraction, sometimes it could be even after case history. Depends on the level of the student, of course. As for clinical findings, definitely if they see an APD, I tell them, hey, I need to see this. And then cover test for strap patients. And then charting, that's a big one, because every school is a bit different. My personal preference, end of day, but with some places giving remote access because of the pandemic and everything we went through, sometimes you have to give them an actual time limit. And I highly stress give them a time limit, because if you tell them just get it done as soon as you can, expect them to do it after the weekend, after a few days, if they remember. That's kind of how that would fly in clinic, if let alone to their own devices. Even then, Dr. Lee mentioned on how to evaluate people. Us specifically, we use daily Meditracks, but I incorporate myself the one-on-one direct communication, which I know Gen Zs really like. Millennials kind of shudder a little bit, being a little afraid when I do that, but they still appreciate knowing the why of things as well. So tell them how they're going to kind of be showing their growth and how we will evaluate them. Again, more testing. So tell them this is what I want for every patient, but then throw in again the why. And then even this one, the last one, consider assigning your patients to the students. This one's a bit controversial, because some of us like the feel of just expect the unexpected, don't have a plan, but at the same time, especially Gen Zers, they like the idea of knowing what to anticipate. Good news is that because of their level of autonomy, they will prepare for everybody. So they might over prepare, but at least they'll be ready for you. Okay, so there's some ideas and mentality in that end. And ultimately, this all constructs a way that communication should now be open for between both ways, right? And so sometimes case presentations are one of the trickier things to do. So this kind of scenario is how I lead through a millennial Gen Z case presentation. Let me go back a bit. I guess I must have skipped a bit. But with the case presentation situation, basically, I let them, both generations, just present however they like, right? And then from there, I regurgitate everything they said, even if there's silly points in there, and make them known, but I give them structure. After that, then what I do is I kind of tell them why I want the structure, why it happens. And then lastly, I give them the summary points. So in summary points by far hit home with Gen Z, and just deconstructing it hits millennials the most in that sense. But as I keep alluding to, it's the why. They might like the why in different ways. Millennials like the why because they want to know how things work, versus maybe Gen Zs like the why because why does this matter in the whole picture of things, But the point is, the why is the big question we have to keep in mind in their head. And that's going to help you cater and hear both, reach out to both generations essentially. So moving forward here, camaraderie is the next level. So creating another deeper set of connection here. Simple things, clinical interest, a little bit of personal interest, and your own experiences as a student. So these three scenarios will hit home in different ways. Clinical interest is something that we can easily share. I mean, it's basically just them asking us, why are we still here? Why are we still in our profession? Why are we still in academia? It's the question we got over and over again during optometry interviews, and you're going to hear it from students all the time. It's something that I think they look for, especially after me being clinical faculty. I see them at third and fourth year. They're burnt out first and second years. They want to hear why I'm still doing this. So something simple like that creates that bond. Personal interest, this one is where you have to have a sense of judgment. You know, you don't want to share too much potentially. You want to keep it surface level because you want to maintain the student-doctor dynamic in clinic, but it doesn't hurt to share your favorite TV show or movie potentially. Or they might ask you, do you game? By the way, do you game is kind of a little attribute that both generations do. They like to shorthand a lot of things. So if they're not sending you emotions, emoticons, or reactions, they're going to have bad grammar. Okay, it's a text mentality essentially. Simple things like that. So I wouldn't say go out and have a beer with them per se, but, you know, talk to them about simple things, you know, maybe any cool movies you saw at the movie theaters lately. And lastly, your experiences as a student. So this goes back to the first idea about the clinical aspect of things. You know, they want to know how you overcame certain challenges. I myself being at Western, actually, this is where I see a lot of diversity and a lot of Hispanics, and they ask me how I do it because I'm one of the few Hispanic faces they might see. So that's a bond that I get with a lot of students here that they appreciate, I appreciate, and helps us all grow together. And in addition, they sometimes want to know how we got through boards, how we got licensed and everything. So I have the advantage of being clinical faculty that they see me as a brand new person, so I get these questions all the time. So I am a little bit more tailored as to what I can and can't say, and know I know how to do that. But if you're open to it, then you can create a better environment, which is where I'll hand off to Dr. Wu, so you can continue onwards.
Yes, thank you so much, Dr. Barajas. So continue on with our discussion. I wanted to touch upon this point where it is really important to create a safe environment at which the students feel that they're not being judged whenever they ask questions. As we tell our students all the time that there is no dumb question, you know. We should be encouraging them to ask questions so that we kind of continue or keep their engagement in clinic. Let's see here. Is this working? Okay, maybe Dr. Barajas. Oh, okay, cool. Okay. And in addition to that, once a safe environment has been built, once you have gained mutual trust from your students, you should be more comfortable with asking questions back towards them. So we do want to hold each other accountable during clinic, and by creating a safe environment first, we should feel comfortable with regards to asking them questions back to kind of further engage them. For example, using professional language in the medical field is, you know, very, very important. And this example where I'm sure we get this all the time from students when they say, oh, the eyes are red, or the eyes are puffy, you know, using language that may not be professional when they do come in for their check-ins. We want to kind of gently correct them. Okay, we are in a medical facility. We want to make sure we sound professional. There are actual medical terminology that we can substitute even instead of using these kind of layperson terms. So, you know, that's kind of an example that I commonly get here. What happens when they continue to repeat their mistakes? So similarly to what we talked about on the previous slide, we should, once a trusting environment has been established, we should feel comfortable with kind of pointing them out, even if they are repeated ones, pointing out to the students that these are repeated mistakes. asking and kind of try to gain a deeper understanding to kind of like, were they just not listening to us, or are they distracted with other things in life, kind of what we talked about in the previous segment. And this may not be a bad time to revisit some of the expectations that you have set forward on day one. The next concept, that vibe, so to speak, is leading by example. This is a huge one for both generations. They don't want to be just being told what to do. They want to see that you care just as much and that we're playing for the same team. So one of the first tips that I have, or I would like to share, is sometimes when your clinic is running really behind, behind by 4 or 5 patients, the students are just really struggling to keep time. Sometimes it may not hurt to step in as a mentor and perform some of the pre-testing like AR, take the OCT for them so that they can kind of wrap up their consultation faster. All of these little things that ultimately may not really harm their clinical learning. I'm assuming this is after you have already demonstrated how to perform the actual tests, of course. This will show them that we're once again, we're all playing for the same team. We're not just using them. I'm sure a lot of us have heard that phrase a lot during our teaching careers. This is showing them by action and not just with our words. The next thing that we can also show them that we are leading by example is by tidying up equipment. So this strikes really close to my heart, as I work very frequently in the vision therapy clinic, where there's a ton of equipment always lying around. There's always a lot of things that I ask my students to grab prior to the patient's arrival. At the end of the day, everything's kind of scattered everywhere. And, in the first couple of weeks, they may not know where things rest because they're new to the module. But 2, by kind of taking the initiative to put away some of these equipment and show them where these equipment actually reside, this will kind of, once again, reiterate to them that, hey, I am not just telling you guys what to do. I'm not your commander. We are here on the same team. We're trying to get out on time. It'll be faster if everyone worked together. So. Okay. Next, we always try to encourage our student learners to kind of conduct their own clinical research after they have seen a cool case. For example, they may not, especially right now, as all of us are dealing with brand new third-year clinicians who are just trying to keep their heads above the water, trying to see their first patients right now. They're not going to have the bandwidth right now to kind of think about, oh yeah, I need to do this research. I need to look up some articles on this particular condition that my instructor have talked about today. This is a great time for us to actually step in and kind of show them, okay, this is how I typically conduct my clinical research. I do it probably right after the patient's gone, so that I can at least write down the condition's name so that I can go back home and look it up. And these are the websites that are more trustworthy, are more reliable to look up. And these are the types of articles that would benefit me. So kind of taking the first step to show them this process right now, especially, will kind of a lot of our message will kind of hit home right now. Okay. And that segues into this discussion. So we're just going to talk about this briefly. This is also a great time for us to teach them how do we actually communicate with different disciplines. So for example, we communicate frequently to patients' PCPs, to ophthalmologists. Those are probably the 2 biggest groups of medical professionals that we communicate with as optometrists. When they're first faced with a referral letter, I'm pretty sure most of your students are not going to know where to even start. Gen Z in particular likes to have a sense of security, like what Dr. Barajas was mentioning. In order to kind of provide them with that sense of security, we might want to consider having preset letter templates and then go through one of their first letters together with your students, showing them which details to pay attention to. Make sure we change the pronouns he and she. It'll be very embarrassing for you to send a letter to a PCP for a male patient and there's a bunch of she's and hers on your letters. Just like little things like that. Go through it with them, have them have that sense of security, and then they can try to kind of start the second letter on their own. And speaking of details, there are certain letters that are to maybe school counselors or other people who, where HIPAA details are not as key, but there are definitely other times when you want to kind of specify, okay, well, this is a letter where identifier should be, we should be more careful on certain types of details. And lastly, lead by example and arrive early. If all your students consistently arrive prior to you, it sends really the wrong message to them. If you expect them to be early, you should be earlier than them. So that's kind of, again, the mindset of leading by example that we should be establishing really early on. Lastly, we'll touch upon fairness, which is equal treatment and just being consistent with how we treat different student learners. So obviously, this goes without saying, we should always try to show a level of equality between all students. One of the key kind of moments when this is really important, and I find myself guilty of this sometimes too, is when you see a really cool case with a student, after the patient leaves, we just want to talk to them about, oh, this is what we learned, this is what I thought was really cool. And then you go into this like 10-minute talk about this one condition. A lot of that information will probably be also beneficial for everyone else in the module. So make sure you kind of catch yourself and make time at the end of clinic or at the beginning of the next clinic to talk about all the learning points from the previous patient. So make sure that you try to equalize the amount of learning between the different students. Secondly, of course, we all make mistakes. We're all human. When we make mistakes, while it is important to point out how and why the mistake was made, it's also important to teach your student learners how do we actually make sure it doesn't happen again. And maybe along the same thought process, that can also help prevent similar mistakes from being made in the future. And also, a lot of the new student learners these days are very kind of sensitive towards being judged by their peers or even just not by their peers. So make sure when we have these discussions about learning points and constructive feedback, kind of be mindful of who else is in the vicinity. And lastly, be consistent. Once again, I need to stress this. Be consistent with how you treat different students. Favoritism, it doesn't matter what generation we're in. Favoritism is just not really conducive to a good working environment. But on a similar note, sometimes when a lot of things happen in our own lives, it's really important to kind of keep a personal versus professional like mindset. So while it is useful to share certain things to students to make yourself more approachable or more relatable, make sure you're not taking your frustrations out from something totally unrelated to clinic out on your students. That's what vacation time, that's what sick leave is for. And finally, we just wanted to touch upon, again, a lot of these points that we have talked about during our segment are are basically inspired by what Dr. Lee's article was on. So transparency is huge with the current generation. A sense of camaraderie can really help you be more approachable and therefore build a stronger trusting environment, which then will facilitate them in feeling more comfortable with asking us questions. And then everyone learns better that way as well. Lead by example, make sure you treat everyone fairly, but consistently, once again. And to wrap up my segment here, I just created this by no means complete list of, let's see here, let's see if we can get the next slide. List of different Gen Z talk, so to speak. Those of us with like kids at home, if you ever hear these terms being thrown around, here's some, this is how we can kind of, this is what it means basically. And with that, we would like to thank ASCO for inviting us to this great presentation, great topic, very, very, passionate with this, because Gen Z will be in our workforce for a very long time, and it's really important to have these discussions right now. Thank you so much again.
Well, thank you so much for excellent segments to both Dr. Wu and Dr. Barajas. We're going to go ahead and take a few questions here so we can do that. And Dr. Wu, I have to tell you, yesterday after you shared your presentation, I showed all those little slangs to my 15-year-old. He was very impressed that I was able to. I asked him what she knew, and he knew them all. So you are on target. One of the first questions that we have is much of the information shared is about working with Generation X and learning to adapt to their ways of thinking. I heard the word safety and security through everybody's presentations, but is there a point where Generation X should also be asked to adapt and understand to different ways of viewing a situation and kind of the importance of taking learning risks? What's your view on this?
I can go get started first. I definitely think in keeping in lieu of kind of the whole theme with equality and also inclusivity, I think it's really fair to expect both sides to be able to adapt. But sometimes with the newer generations, and this goes back to my discussion with kind of lead by example, we may have to take that first step before we can kind of expect the other side to reciprocate. Dr. Barajas, do you have anything else to add?
Yeah, absolutely. So it's once you create that sense of environment that they're looking for, that security blanket idea, you should be able to pretty much establish that communication that they should also be able to adapt to you. You can call them out on it, saying, hey, isn't it fair that I'm supposed to be teaching you? You're supposed to also adapt to what I need. So when I talked about structure and everything like that, that's me telling them that this is what I would like to see, this is what I would require. And they are a very well informed, mentally informed group that they should be able to understand that, I hope, most of the time, right? So they should be able to adapt. They are an adaptable bunch for sure.
Well, good. Thank you to you both. We're going to ask one more question. And the second question is, do you have any personal tips for an efficient and effective orientation to clinic in terms of method, delivery, length of time needed? Just that whole idea, there's so much that we have to share with them. All at once can certainly be a bit much. So what are your ideas on orientation to decrease the overwhelm, increase the absorption?
Yeah, certainly. I think it's definitely very useful to have something in print or in writing, even if you don't expect all your students to kind of read all of that once they get home. But I think it's definitely really important to have things in writing. I've had some colleagues before of mine who actually will have like a very short 10-slide presentation thing that would take like 3 minutes to go through, and then they take another kind of like 10 to 15 minutes to just go over like where you expect the checking in to be, and then just like a quick tour through the clinic, especially for clinics such as like neuro rehab, vision therapy, where there's a lot of like equipment that's sitting at like all different places. just to kind of like guide them through. And something that is also useful would be like an icebreaker, where before you even talk about everything, ask them, oh, what are your worries for this rotation? And what are you looking forward to gain from it? So yeah, Dr. Barajas.
I mean, I would only add that I do exactly what Dr. Wu says in terms of establishing that in person, but even before that, I tend to email them, especially in primary care clinics. I would email them a packet that kind of summarizes or has everything I want essentially, but then at the end, there's a timeline of do this by a certain time, check in by this certain time, to kind of just make it easier to digest. So I do a little bit of catering to both. That sounds.
Okay, are there any other questions that were in there? I didn't see any others. Any others? All right, I think we're good. We'll go ahead and move on then. Thank you so much again to both Dr. Barajas and Dr. Wu for sharing with us today some of those clinical teaching strategies. Dr. Moy is going to now take a moment to introduce an exciting new project from the Clinical Affairs SIG.
Thank you, Dr. Kattouf. It's my pleasure to reveal the first half of the new ASCO Clinical Preceptors Toolkit. The Clinical Affairs SIG realizes that many optometry faculty enter academia without formal educational training, and they learn on the job. And so we wanted to provide fundamental information about precepting and resources such as clinical teaching tools, mental health resources, and guidelines for communication between preceptors and students. So hopefully you can see this. I'd like to show you the website to the extent that is finished now. And basically we plan on adding in teaching tools as we go. And so the first part here is basic principles of precepting, obviously more for new preceptors who are coming right in. Then we have communication, which is pretty meaty inside. And then once we get to it, teaching strategies, assessment in the clinical setting, and when nothing else works, some tips for that as well. And so basic principles of precepting is our first section. And this goes through actual just foundational items that a new preceptor should know. And then if you go into section 2, this is all on communication. And so we have basic principles of communication as a preceptor with your student, communication skills of the student, feedback and emotional preparedness. And I'll just click in on one of these subgroups to show you. And so we have articles linked, we have preceptor pearls about some actual situations that might apply, what happens if a student has a tendency to cry, and so on and so forth. And then additional resources at the bottom with articles to read. And so we really hope that as we build this, that we can include more and more faculty across the country. And our next section is teaching strategies. And we would really welcome any common articles you use for student assignments, small group learning strategies, gamification for learning in the clinic, any other creative tools specific to your specialty or in general that faculty across the country are willing to share. So if you have any creative clinical teaching tool that you'd like to share, please email me at moya@neco.edu, or Jennifer Rubin can also pass it along to me. So thanks for listening. And I'm going to turn the screen back to Jen as we continue our next part. Thank you. And so our last portion of today's program is a panel on clinical best practices in various student scenarios. Our first panelist is Dr. Raymond Maeda, Associate Dean of Clinical Affairs at Western University. Our second panelist is Dr. Eilene Kinzer, Associate Professor and Director of Continuing Ed at the Kentucky School of Optometry of the University of Pikeville. Our third panelist is Dr. Konstantina Kalis, Assistant Professor at the Chicago College of Optometry, Midwestern University. I want to thank our panelists for their willingness to share their wisdom today. Panelists, our scenarios will be briefly read here by Dr. Kattouf. Dr. Maeda, would you take the first scenario and describe how you as the preceptor would handle this situation And then we will have the other panelists give a 30-second response as well. I'll turn it over to you now, Dr. Kattouf.
Thank you, Dr. Moy. So for Dr. Maeda, we have our first scenario, which is you have a third-year intern in your clinic who keeps arriving late to their clinic session. They don't call or email that they're going to be late. They also tend to just rush in, quickly set up in their room, and breathlessly go and call their first patient of the day. You've talked with them about arriving 15 minutes before the session in order to prepare, but so far they're still coming late. The exam room is disorganized, and when you enter to finish the dilation, they're just having trouble finding things when you ask them for equipment during the exam. What are the points of improvement here, and how would you address these areas?
So with the summer clinic starting, I think this is something we've all done. We've had our orientation for the students. Both we do one in the classroom and in the clinic, and we reiterate these things about expectations of tardiness. And so this is one thing I would go back to with the student, make them aware of what the consequences are. Once again, I think being very clear, black and white, them understanding what their responsibilities are is important. Also to making sure they understand that when they present themselves in this manner, being a student intern or a future healthcare provider, they're kind of setting the foundation for how they're going to be in practice. And I think they need to realize that to establish good habits starts now as an intern. And so if they are unprepared, if they're rushing, and they most likely are probably presenting themselves to the patient, that is not how you want to present yourself as a provider. So I always kind of flip it sometimes with the students and ask them, if you're the patient, what is your expectation of your provider? And I think it kind of helps them reflect on things. And so you always want to try and make it a team thing, but obviously the responsibility is on the student, and just being very clear of the expectations. Once again, the other thing we'll do as well is I think all of our providers have some nuances to their approach. And so we give them some time to set the foundation for expectations. So we give them some time, or want to start the clinic earlier on that first day. We always kind of recommend that, but we also try and give some broad expectations to all the students as well. So once again, I think reiterating these things, we all know orientation, because ours is long. Students sometimes will kind of fade after about an hour or two. So just reiterating and letting them know where the information is located is the best thing.
All right, well, thank you, Dr. Maeda. Let's move on to Dr. Kinzer and any additional information you have to share on that scenario.
Yeah, I agree with, setting expectations on the matter of, the student kind of being disorganized and kind of trying to struggle with figuring out what's going on in the exam, not only arriving 15 minutes earlier, but also using the information from Dr. Wu and Dr. Barajas' presentation of also having them maybe look at that EMR ahead of time so they can see what those patients are, have a game plan coming in, and maybe that will help them kind of guide them with it if they are just coming in at that 15 minutes when maybe 30 minutes might be more beneficial.
Very good, thank you. And we'll wrap up this first scenario with Dr. Kalis.
I know the discussion so far has been about students, but I think it's also important that, amongst all faculty, we're applying appropriate policies and procedures fairly across everyone. So, for example, for frequent abusers of tardiness, we have specific policies where clinic makeups are made for a 2-to-1 ratio. That's usually enough to get students to arrive to clinic on time. But as far as a messy room, I always tell my students that an organized room allows for organized thoughts, and that can often help with their case presentation as well.
Those are good. Certainly no one wants to make up double the slots, so that's a good one. All right, so the second scenario, we're going to go ahead and Dr. Kinzer, I'm going to ask you to respond to this one first. Your third-year intern comes back to your office and just announces, "I'm done." You have no idea what they're talking about since you've seen 5 patients since they were last in your office. In addition, once you realize they're done with the dilated fundus exam, they describe their patient and saying that they have a brown thing on their eye, and I want to know what it is. What are the points of improvement here, and how would you address these areas?
Yeah, this is very common, especially with first term third years, right? They're still trying to learn how to do a proper case presentation. So what I like to do is just help guide them through that process. So if they're saying, "I'm done," you can ask them, "Can you please clarify, first off, which patient do you have? Can you give me some demographics? What's their chief complaint?" This is a 21-year-old Caucasian female coming in with blurry vision at near only. or up, far away only. And then ask them what tests have they already performed and what are those findings? Do those findings correlate with that chief complaint? If not, do we need to do additional testing? What are our list of differentials that we have thought of before we decide to proceed with the dilation? And then also, before you go into the room, do they have any thoughts on combining that information they found with that chief complaint and their differential diagnosis? Do they have a treatment plan? For third year, sometimes it's hard to use their layman terms to connect with the patient and educate them. So I do like to have the students practice their education before we go into the room together. And then as far as the brown thing in their eye, what is it? Students sometimes don't have that diagnosis quite yet. So again, I like to do a little hand holding, walk them through that process. So ask them, can you clarify a little bit more? Where is it located? It's in the retina, it's in the mid periphery, it's superior temporal. Which eye is it located in? Can you describe it a little bit further? What's the size? What's the shape? What's the coloration? Is it elevated? And that will help them guide them through to their differential diagnosis. And not all of them have it right off the top of their head. They can't name, the top 2 or 3 that it might be. And so I like to show them different resources. So you could do iWiki, Mass Eye, Will's Eye Manual, different resources of taking these descriptors that we have and how can we come up with that differential and also that treatment plan. I like to give a little hint on treatment plan since they're still new for third year, but also provide them resources and show them how I like to look at things, especially when you don't quite have a diagnosis. What are resources? How can we consult with someone as well?
Very good. Thanks, Dr. Kinzer. How about you, Dr. Kalis? Did you want to reflect on kind of the student coming in with not the most professional communication, I should say?
I think we should actually take a quick moment of silence for all those that are precepting clinical third years right now. I know it's a rough quarter, but we can get through it. I know we sometimes question like, oh my gosh, why am I doing this right now? But we are helping them eventually. At some point, they'll be better clinicians. I'm one to not shy away from assigning homework as well. So I'll echo what Dr. Kinzer said. Like, of course, we can help guide them initially with helping descriptions of certain clinical findings, but I often have them write a quick summary of what they saw that day. Not only does it help them kind of synthesize a little bit more of what they learned didactically to now clinically, but it'll also help them for future findings that they're not quite sure of and how to kind of describe them at that point.
Very good. And how about you, Dr. Maeda? Any extras to add there?
I think the key points were hit definitely, but I think just tailing on the last one, also Dr. Kalis is I like to try and do also wrap up at the end. Students, every student present a case. And once again, if you don't have the time, this is where I tell them go home, review this, and then be prepared to present it next week and do that. And I tell them bullet points. You shouldn't spend more than 30 minutes on this. And just, these little things, I think making them own their own and hold accountability for their learning is critical as well. And I think as they get in these habits, once again, these are things that'll definitely create on to fourth year. And so just establishing the foundation for these things. But yeah, for this case, I think, yeah, everyone's hit it around the head. So
sounds good. All right, let's go ahead and move on to our third scenario. I'm going to present this to you first, Dr. Kalis. Your fourth year intern does not seem very engaged in clinic. They show up on time, they see patients, they report to you on their cases, and then they go home. But they don't ask questions about their cases. They're not actively checking if patients have arrived, and it's hard to tell if they're bored, depressed, anxious, or another emotion. They do not smile and they're always checking their phone. While their clinical performance is average and on track, you sense that something is off. So what might you do in a situation similar to that?
Well, first off, personally, this scenario would typically never happen to me because I weirdly know way too much about my students' lives. But assuming, let's say this is a student I don't really know, I think this is a very similar case to what Dr. Lee presented in her presentation earlier. A little bit of empathy goes a long way, pulling a student aside, having a conversation with them. If there's anything going on in their life or school that you can help with, usually that's enough to make them feel a little bit more comfortable sharing what might be going on with them. Those type of students, I always recommend whatever services or resources we have here at the university for them to either seek mental health specialists, et cetera. But if it's those students that say no, everything's good, and maybe truly it's just, I don't know, the way their face rests, then you can always just have a discussion about how participation and interest in clinic will not only help them further, again, synthesize those connections between didactic and clinical training, but make them better clinicians for their future seeing patients on their own.
Very good. How about you, Dr. Kinzer? Any responses to that scenario?
Yeah, I think, trying to figure out what's going on with them, especially if you don't know that student very well, sometimes that might be hard for them to feel comfortable speaking to you. So I also would like to just kind of give them some time for self-reflection, instead of asking them about their personal life, maybe asking them like, how do you feel like you're doing with your clinical skills? How do you feel like your patient care is doing? Do you feel like you're showing, attention to your patient? Do you feel like you're providing the right compassion for your patient? And sometimes that can open the door to conversations to where you can talk a little bit more and they feel more comfortable with you. So just kind of slowly leading them to where they can disclose what's happening, or say, hey, I do need to talk to maybe some of our student affairs services, so I can, be a little bit more prepared for clinic the next time.
Very good. And Dr. Maeda, I'll go ahead and end with you on our clinical scenarios.
Yeah, I would, along with the last statement, this is where, once again, students a lot of times aren't comfortable with a faculty member who they're not comfortable with, so they may not share. But as what was stated, I think this is a private conversation that needs to occur, seeing how they're doing, if there's something else happening. And then what I usually like to do is get the director of student affairs engaged, because she has worked with these students from day one. And, once again, I would make sure to probably check back in a week, check in with that person and make sure, have you talked to this student? And then I would probably touch back with the student again to the following clinic session, just to make sure, and just, once again, make them more resources on campus that they can reach out to, once again, because they may not be comfortable having that deep discussion with the faculty, but I think the more we can provide the resources for them, but I think we can't forget to always touch back with the student.
Very good. Thank you all. I don't think there's any of us who haven't been in each one of those situations, or some varying degree of them. I saw in the chat there was a question, it may have been a little bit earlier, but it was talking about just, that whole idea of, again, us adapting to students, and there's maybe a lack of the students understanding or respecting seniority. And, instead of us having to do it, to model it for them, is it above expectation to just say, I've asked you to do this, I need you to do it? So maybe Dr. Kalis, you could respond on that one.
Yeah, as you guys can probably tell by the way I'm answering my questions, I'm a little bit more blasé with my students, and I like to joke around and make people feel comfortable. But in those situations, it's not that challenging to put your foot down and be like, these are conversations that we've had before. We just need to figure out, is there something that I can do to help you continue to be successful in clinic? And if not, then it's a conversation that might need to be had with maybe higher ups, like administration team, like that.
Very good. And how about a question here? Do you feel it's possible to get the student to behave in a professional and desired manner without an established protocol of consequences? I know Dr. Kalis had actually mentioned the consequences of, if you're repetitively late, you have to make up more clinic sessions. So Dr. Maeda, how do you feel about a protocol of consequences, or do you prefer more just consistent communication?
Honestly, I think both. You need to honestly, if you don't have consequences, I think it's difficult, because you have to remember, as a faculty, we have to be consistent. If we don't go by protocol, there's some concern of consistency. You definitely want to make sure that the student is aware of that, and also you call the student out on making sure they're understanding what these consequences are. So I think, once again, having these conversations, just reminding them, once again, this is what the consequences are if you're late the first time, second time, third time. And, hopefully too, they will be able to see that and just understand that. And, end of the day, I think we do have to hold our students accountable, right? Accountability is a big thing, so.
Great response. And our last question, I'll ask you, Dr. Kinzer. In your experience, do you find more students have a natural sense of professionalism and preparedness, or do you feel more of a need, these skills have to be taught?
Yeah, I definitely think the conversations we've had with the two presentations about understanding the different generations. I don't know if it's a little bit of generational, but also just COVID mixed into that, where they're not having that interprofessional skill and understanding what expected behavior is. And so what we do is trying to give some outlines for them. And sometimes we say, you probably already know all these things, but I just want to make sure that we're all on the same page. Here are the types of behaviors we expect from you, and how to properly communicate.
Very good. Well, thank you all. I want to thank you so much again to all of our panelists for sharing their wisdom with us. I'm going to now go ahead and turn things over to Dr. Waldorf now for a few final words to wrap things up.
Well, thank you to our speakers, Dr. Lee, Dr. Wu, Dr. Barajas, and to our panelists, Dr. Kinzer, Dr. Maeda, and Dr. Kalis for sharing your expertise and experiences today. Thank you to our co-moderators, Dr. Kattouf and Dr. Moy. I know I'm really looking forward to implementing some of these strategies and educational pearls in the clinics I work in next week. And I also want to encourage you to take a moment to check out that website that Dr. Moy was sharing. I poked around on it a little bit, and it's incredibly accessible for new preceptors, and it's going to be a really useful tool for us. Please keep an eye out for an email with the SurveyMonkey link and take a few minutes to provide us with some feedback about today's program. We do read this feedback, and it is really useful in helping us planning future events. Thank you again to the OSEF moderators, ASCO's planning committee, and the ASCO staff for this wonderful event. And I hope everyone has a wonderful weekend. That's the end of our program.